Namaskar. Welcome to Ahara Arogya Adhyatma, the light of Samskara. Today we have Padma Shri Dr. C. R. Chandrasekhar. He retired as a medical superintendent of the prestigious NIMHANS Institute. And more than that, he has been continuously a very good writer. Hundreds of books he has written for the public to bring awareness among them so that, they don't have the myths in their mind. And today he has come here to tell us, talk to us, and explain to us why the headache occurs and what to do when the headache occurs. Sir, namaskar. Welcome to you, sir. In
Namaste,
fact,
namaste.
when you said the headache, I remembered when I took my very first theory class. After the finishing the class, a boy came after me and he said, ma'am, I've got a brain tumor, I've got excruciating headache. So I said, Arey Baba, go and get your eyes checked, you wear the specs and your headache will go. And this is how, if the medical students will also have. And nowadays, I have seen, sir, when you ask the elders, how many of you have never had a headache along with me, 10 to 20 people will raise their hands because the old timers, they have got a very disciplined life. Whereas the children, you go to the school, not a single child will raise because all the children are perpetually under stress or looking into mobile and they have got the headache sometime or the other. So please tell us about the headache, why it comes and how to treat it, sir.
Headache is the most common pain human beings suffer. Headache is the most common pain because any doctor, any hospital, if you go and see, majority of people who come to a doctor suffer from headache. And other aches are back pain and chest pain and pain of the abdomen and pain in the limbs and so on. So headache is the most common symptom because we make the head muscles stiff by tension, by stress. So stress is the most common cause
when you said the muscle go into spasm, I realized to smile, you require only 12 muscles to relax. But to frown, you require 72 muscles, they go into spasm. So the
anger,
frowners,
double,
in
anger, double the number of muscles. Anger, you have
to all
make
the
a face.
Yes,
So,
yes.
Please remember, headache, 90% of headache is due to stress or you are unhappy. Unhappy with your wife, unhappy with your husband.
Unhappy with everyone and unhappy with oneself.
A student came to me. When you get a headache, sir, in the mathematics class, mathematics.
Okay.
I don't like the teacher. The way he teaches is so boring. If I attend his class, definitely I get headache. So headache is very common and all age groups. Children, adolescent boys and girls, young people, middle age, old age. Nowadays we worry about everything. We think that our children are not looking after us. We don't have money. We are not independent. We are suffering and so many illnesses. And we are worried about death and dying. So worrying is the most common cause of tension and headache. And in tension, as you make a fist, 2 minutes to make a fist, it pains. So analogy is same thing. If you think more, think negatively, or invite negative emotions like anger, fear, and sadness, and jealousy. Suppose if you see your sister having a new necklace, you get headache. You get headache. You get headache.
Okay.
How can she buy a platinum necklace? I don't have one. So jealousy is another common cause of headache in women. Because women are more jealous all over the world.
No, sir. I don't agree. The jealousy, thy name is human.
Shakespeare said, jealousy, thy name is woman.
Human.
Of course, jealousy can be there in men also. In a lighter vein, I told. So children suffer because of academic stress, and then fear of failure. Because when they prepare for the examination, they get severe headache and they start crying. I want to study. Next week is the examination, and I'm having severe headache. I can't open the eyes. I can't read. So please, I request all the students not to have fear or anticipatory anxiety. And also a person who wants to go to an interview, 2 days earlier itself, he'll get headache. Will get headache. Or once the interview is over, he comes out with severe headache because he thinks that he hasn't done well. There is no chance of he getting selected in the interview. So second one is migraine. Migraine is very common and it's a genetic also. It runs in families. In migraine, one side headache, either left side or right side headache.
Right side.
It starts with a aura, what we call a warning sign. Suddenly you may see a flash of light in front of you. Suddenly you feel like nausea and vomiting or some odd sensation, and headache grips you. It's a very one of the severe pain human beings suffer, migraine headache. And they go to bed, they close the windows, they can't see the light, they can't hear any sound, and 2-3 hours they suffer a lot. So migraine is a episodic headache, one side headache, and then you have to learn to control and prevent migraine because migraine cannot be cured. Migraine cannot be cured. It has to be controlled, like diabetes.
It has to be prevented. Yeah.
Prevented. One is timely food. Empty stomach can precipitate migraine. Sleepless nights can precipitate headache. Some food items, allergic reaction can precipitate headache. Then watching a movie in a small screen or looking at the mobile for a longer time, you can get migraine headache. Or sounds, so like DJ, sit in a musical concert and near the
loud music, very loud.
Any loud noise can precipitate a migraine headache. So avoid all those triggering factors of migraine. And as soon as you get the aura, swallow a tablet, the Noxtam or any other painkiller, your doctor will prescribe you. And also we give them tranquilizers to make them, generally, migraine headache people are anxious people and they go into tension very easily. You prescribe them either Sibelium tablet at night or any minor tranquilizers to cut down their tension and cut down their anxiety. And third one is sinusitis. Sinusitis headache, infection of the sinuses.
Frontal headache.
Frontal headache and maxillary headache, below the eyes headache. Infection is there, so you have to go to a ENT doctor and find out. They will take an X-ray, find out whether haziness in the sinuses, and they give you antibiotics or frequently for getting then enteral wash and correct the deviated nasal septum. Or eyesight problem. Eyesight problem is again common whenever you use the eyes for a longer
headache. It will be at the back.
Occipital headache or in and around the eyes. In and around the eyes.
Yes.
Then if you take a study, say I read a lot continuously, I see mobile continuously, or I can't see small letters, I have to squeeze my eyes and see. So long sight or short sight or any eye problem or even glaucoma. Glaucoma can cause glaucoma, increase the pressure inside the eye. So you have to contact a eye doctor if there is, as you said, occipital headache or it is in and around the eyes, inside the eyes. Then you must contact eye specialist. And then trigeminal neuralgia, the nerve which comes behind the ear.
Supplying the face, the whole face is supplied. Yes.
Then it's a shooting pain and chewing increase the pain and it's a miserable way.
Very painful,
And you have to take carbamazepine tablet to prevent trigeminal neuralgia or even blocking the nerve. If the pain is very severe, they block the nerve with alcohol or minor surgery is done to give relief to the trigeminal neuralgia. And lastly, any raised intracranial pressure. The pressure inside the skull increased by tumor or hemorrhage, bleeding inside the brain, and usually diabetics and hypertensives. People having diabetes, no control. People having BP, no control, because people ignore because they get fed up. Sir, how long I should take tablets? I'm fed up, and they can't follow food restriction, and there will be bleed inside the brain. Suddenly, if the 50 years old, 60 years old person complains of severe headache, think of hemorrhage, and immediately the person has to be taken to a hospital.
And also, if they have diabetes, if their blood sugar goes down, also they get. If it increases, also. So any diabetic, they should be careful not only about the brain and also their blood sugar.
Blood sugar, and also suddenly if the BP shoots up, because of
And their
anger.
eyesight also is affected, and that also gives rise to the diabetic retinopathy. Yes, sir.
So in this way, headache is a symptom. Please remember, headache is not a disease.
Disease.
Headache
Correct.
is not a killing disease. It's only it
Absolutely.
troubles
Yes.
you. One should not think of tumor as soon as they get
Yes.
headache. As soon as headache.
Like my student.
Nowadays, in private hospitals, some private hospital, you ask or not, they carry an MRI and scanning and give a beautiful report and charge you 20,000 rupees, 30,000 rupees. Unnecessary investigations are done. Unnecessary referrals are made.
And then they tell just take this paracetamol and write a prescription for the 10 rupees tablet. Okay.
Take Dolo 650. So this type of mismanagement occurs both by the patient and by the doctors. Doctors are pressurized. Here in our center, sir, please write MRI. I'll get it done. I don't mind spending. I'm worried.
No. If you don't write MRI, they think that you are not a good doctor.
Not a good doctor, not responding to their request. They will go to another doctor and get the test. Otherwise, people go straight away to a lab and
MRI
get the MRI
and come with the report.
Come with the report. So headache is a little bit, it is a troublesome problem, symptom, and one should not get fearful because think that I have a tumor, I have bleeding inside the brain, or this headache may kill me because pain may be very severe. In migraine, severe pain, or in trigeminal neuralgia, very severe pain. So in tension headache, they say, sir, 10 kg so slab is put on my head. That type of pain they experience. And children suffer, adolescents suffer, women suffer during menstrual cycle or
because
during
of the
menopause.
hormonal imbalance.
Hormonal imbalance is there. Imbalance is there. Or if any fever or infection anywhere can give rise to headache.
Yes.
Any fever, high fever, and any infection somewhere, though infection may be somewhere else, but you may get a headache along with fever. So one should be very cautious to find out why they are getting headache. If you are getting frequent headache, please go to a general practitioner or family physician. Don't go to a special hospital or super specialty hospital. They mismanage the problem and they make you to spend more for unnecessary investigations.
But one thing, sir, if the older people suddenly if they get headache, suppose they fall and they get giddiness, they must go to the specialist without wasting their time here and there.
Yeah. Another is this post-traumatic or post-head injury headache. Because many people, they say, I'm having headache last 10 years because 10 years back I hit my head against the wall 10 years ago. So they think that any hit on the head 10 years ago, 15 years ago, they attribute the headache to that injury.
Is not responsible for this. No.
One should not think because our skull bone is very strong.
Very strong.
Yes, sir. It can sustain any amount of severe trauma. Only if you have doubt, that's why consult a general practitioner. They will tell you whether to take an X-ray or not, or whether the injury and headache has a relationship. Because many times it is psychogenic. I had
I think 90% of the headaches by history taking itself, we can make the diagnosis.
We can easily make out. So 90% of headaches are stress-related and related to negative thinking or negative emotions. Lead a calm life. Lead a comfortable life. Lead a contentful life. Calm, comfortable, and contentful life.
Just be smiling. Just be smiling. Don't take anything to the headache. Sir, you know something? You have explained so beautifully everything in detail. And till now, I have not had headache. Do you know why? I don't have the head. Namaskar.
I request all the viewers to remember Dr. Vijayalakshmi's face, always smiling.
Thank you, sir.
And no headache. Thank you very much.
Thank you, sir. Thank you so much. Thank you.